Hospitals across the country are seeing a higher than usual surge in demand this season. Many emergency rooms are reporting a growing number of children showing up with respiratory illnesses, and that is pushing some to the brink. As we've been reporting here, the breaking news that, and I'm just going to read from it because it's the latest off the wires, the head of Ontario's Critical Care COVID-19 Command Centre has asked the province's hospitals that treat adults to accept children 14 and older in order to receive intensive care and to relieve the pressure on pediatric hospitals. So that is the situation. It is moving fast in terms of at least the call here from officials to hospitals to accept that 4-year between 14 and 18 children who are in those children's hospitals to be allowed access to adult hospitals. With more on all of this and the latest numbers, the CBC's Mike Crawley has more.
Yeah, John, we've been hearing these anecdotal reports, typically from children's hospitals, about unusually large numbers of kids showing up at ERs with respiratory illnesses. Well, I've tracked down the most up-to-date stats that help show the full extent of the problem. Now, take a look at these numbers. Now, this is for across Ontario. Typically, this time of year, on average, about 800 kids show up every day at ERs for respiratory illnesses. Well, this past week, it's been nearly triple that, pushing 2,200 a day. Now, only a small proportion of these kids are actually sick enough to get admitted. So if we could look at the next numbers for admissions, this number too is also running at about triple the seasonal norm. I heard this from the head of pediatrics at a hospital in Markham, just north of Toronto.
In the context of my professional career and training over the last 12 years, I'd say the numbers of patients that we're seeing, pediatric patients that we're seeing present at the moment has been unprecedented. It's much higher volumes and much earlier in the typical cough and cold season than I've ever experienced.
And John, I heard similar things from other doctors, including ones at hospitals that don't typically see very many children.
Well, Mike, let's talk knock-on effects and the impact all of this is having on hospitals and then patients and then families.
Yeah, so if you show up at an emergency room in Ontario, if you're not among the most urgent cases, you're facing really long waits. Overnight at CHEO, the Children's Hospital in Ottawa, I've seen that the longest wait to see a doctor is in the range of 14 hours. Now, if you get admitted, there can also be a long wait to get moved up to a bed on the hospital wards. Some hospitals, they've started postponing surgeries to free up resources. They're redeploying staff to where the needs are the greatest. And there's actually right now so many kids in the pediatric intensive care units across Ontario that hospitals have now been told to send any kids who are older, aged 14 and up, to the adult ICUs.
Let's talk about what we know about what may be causing this rise in sick children, Mike.
Yeah, so it seems to be driven by a viral respiratory infections. You know, some of it is kids showing up with COVID, but largely it's a virus called RSV. And the theory is that now that public health measures have been, like mask wearing, have been basically abandoned, kids are getting infected by viruses that they've had little exposure to since the pandemic began.
There's just a lot more illness spread out of the changes in our public health mandates, and at the same time we've come through 2 years of relatively protected environments for young children, so their immunity isn't quite where it was.
And John, Ontario's Chief Medical Officer of Health talked yesterday about what he called the triple threat of these viral illnesses among kids, plus the prospect of a bad flu season, plus the possible resurgence of COVID-19 infections. So Dr. Kieran Moore said he's going to be looking over the coming weeks about whether there is a need to bring back some sort of mask mandates in certain indoor locations.
Important information. Thanks for this, Mike. CBC's Mike Crawley in Toronto. And for more on this, we're joined by Patricia Poirier. Now, she was an emergency room patient in Windsor Regional Hospital, and she joins us from Windsor this morning. Patricia, good morning. How you doing?
Good morning. I'm well. How are you?
I'm okay, but I didn't get stuck in an emergency room for 6 hours in the hospital waiting for treatment. What can you tell us about the experience?
Well, when I walked in, I noticed right away that there was a lot of crying, a lot of little kids crying. And I was like, oh, okay, sick kids, it happens. But then as I sat down, there was like more and more coming. And the nurse, he was walking around with a bag that not walking around, but he would go to the back and come back and bring Motrin for all these little kids. And he was like, here's some Motrin, and talk to them and give them all in their seats at the thing. Now, I've never seen that before. And I'm like, oh, wow, there's a lot of kids sick here, coughing and crying. There was even some vomiting going on. I'm like, oh, okay. So I was shocked. Like, I was like, there was so much crying. I started playing peekaboo. I was like playing peekaboo with like little babies just to entertain them for a few minutes, and they would stop crying. And then it started like a chain reaction with other babies.
Now, we've all, most of us anyway, unfortunately, have at one point or another in our lives ended up in a hospital emergency room. Do you have a sense of how many kids you saw? I mean, we're talking about half a dozen, a dozen. Did you get a chance to do kind of a quick head count?
There was always at least 6 or 7. Sometimes there was 10 kids throughout the whole thing, and they were just all there. And the little ones were in the corner, and then some families were in this corner, and it was just kids everywhere. I was just blown away. And here I am with my tonsillectomy, and I'm like, in so much pain, thinking, oh, if I'm feeling this bad, how are these poor little babies feeling? And so I just started to like focus on that instead of my pain. So it kind of helped me get through it in one way. Okay,
fair enough. It's hats off to you for taking a positive attitude. But in terms of your being able to get treatment, did you get a sense of and you, as we understand, there for 6 hours, did you get a sense from staff at all about the volume of people, young and older, and the effect they were having on the system and the wait times for presumably everyone there?
Well, parents kept asking, like, when are we going in? Are we coming up soon? Like, I seen them all going up at their own times, and I just stayed where I was because I'm not going to interfere with the kids, like try to get in front of kids. Oh, no. But there was the nurse, I just kept hearing them say, like, we're just waiting for beds in the back. We can't do nothing until there's more room. And so they wouldn't say a time or anything. Like, they were like, we don't know. We're just keeping you guys content until we can move you in there. And it was kind of sad to see all these babies like crying and sleeping in their mom's arms or dad's arms. And I was like, I didn't even realize that there was such a sickness going around because I've been home. And yeah, I was just very shocked.
When you are there and a witness to this, and this, of course, we see the headlines and we see the numbers, but you were there. What concerns you most about long wait times?
Well, people got overlooked, I think. Like, yes, this is important, but this is worse. Like, how do you measure what's more important in the case where there's so many children there? I struggle with that myself because I would automatically want to say, put all the kids through before I go, but then I'd be there for 24 hours, so.
As I understand it, you're a parent. Does this, having again witnessed this firsthand, does this have any effect on your decisions in terms of concern about your kids, or the fact that we're now heading into, we are not even there yet in terms of what is traditionally the time of year where people get, and young people get, so many respiratory illnesses, and as we see, ending up in the hospital?
I automatically thought, should I be sending my 6-year-old to school? Because she's not even, like, you know, kids touch everything and they put everything in their mouth, and I'm like, oh, I can understand why all these kids are sick. Because they're not protected anymore like they were through COVID time. And a lot of these little kids never experienced before COVID time. So I noticed that myself. I'm like, oh, yeah, they wouldn't know anything but masks. Some of these little kids were wearing masks like no problem. And that was shocking to me.
Yeah, lots of little kids have their whole experience of the outside world has been wearing a mask. But for now, Patricia, I want to thank you for taking the time to tell us your story.
Thank you.
Former emergency room patient at the Windsor Regional Hospital, Patricia Poirier. Thanks.